Hi, everyone. So nice to see you here virtually and in person. Thanks for everybody who made an effort to be here. Aw, this is so nice. My dad's there. Molly. Molly, you're awake. My brother. This is awesome. Okay. Sorry. Daniel, you want to start up with some opening words and then we'll get started. But let me just click. Oh, it is recording. Perfect. I'll trim it afterwards.
Maybe turn your computer on since there's so many people online, so I can speak to them as well.
It is on with the audio. So
Pick
okay.
your camera.
Oh, thank you. There you go.
There you go. Thank you. Hello. Since most of our audience is online, I'll direct my comments to the audience online. But I really want to keep this short because Merav has a lot of information and a lot of interesting results to present. So we'll hear from Merav Cohen, who came to us around March of 2020. And if you know what else came to us in March of 2020, then you know this was a big month for our lab group. Merav was the good news and the coronavirus was the bad news. However, the coronavirus gave us a catalyst to think about resilience, which is the topic of Merav's research. I'll let her introduce that and the title. Just to give you a little bit of background, Merav came to the Social Ecology Lab in 2020. She holds a degree in law from the Hebrew University and a degree in environmental policy from Columbia University. And we're very lucky that all of the forces in the universe caused her to come back to us in 2020. And now she's almost completed her dissertation. We'll leave the rest of the time for her. And thank you all for coming from across the world. It looks to me like we have people from 4 different continents and several different laboratories and several different generations. So it's very nice to have you all here. With no further ado, Merav will present for 45 minutes, and then we'll leave the rest of the 15 to 20 minutes for questions from the audience.
Okay, perfect. Let me just share my screen here.
My alarm will go off at 40 minutes. You'll hear birds. And that means you have 5 more or 10 more minutes.
But it's
or 15 or 24 hours.
I'd rather there not be an alarm setting.
How do you want me to signal to you? Okay. I will start flapping my wings.
I'm looking at the clock. So, okay, sharing my screen. It's screen. This is this. Okay. Super. Just some housekeeping. Just please make sure you're all muted throughout the talk, unless you want to ask questions at the end. And let me see if I can close this down. Oops. And can someone just signal whether you're seeing my screen okay on Zoom? Yeah, is it good? Good, thanks, Jen. Awesome. All right. So again, good afternoon, everybody, and thank you for being here. My name is Merav Cohen, if there are people here who don't know me. I'm very excited to present what I've been working on throughout my PhD. I study what makes social ecological systems more resilient. Let me start with an introduction. If you want to follow on the sidebar here, this part will include the framework for the study, some theoretical background, the research gaps that we aim to address, and the research questions and the design of the study. So the overarching framework for our work is that of social ecological systems research, or social ecology. These are 2 different schools of thought that share a common conceptual foundation, which is that human societies, here in orange, that includes social, economic, cultural, political institutions, etc., all are embedded in the full biophysical system. Now, this picture, which I like, depicts it as a layer, but if you really think of it, it's more like this, because all the layers are really inseparable. They're mixed, kind of like a cake. So social ecological research really observes this cake-like system as a whole, holistically observing their in internal continuous interactions across scales, and facilitating various worlds of knowledge. This is what we mean by transdisciplinary. It's not just academic knowledge. And all of this in order to get a more nuanced understanding of the various aspects that relate to our human existence and to get more innovative tools to deal with the pressing challenges of human development. Now we're talking about resilience. In social ecological systems research, this means the capacity of the system to cope with disturbances without losing its main defining characteristics or its identity in order to avoid a breakdown. For example, if you consider this tree and the system that it supports, it was toppled by some kind of disturbance. All right, if it's resilient, if it endures, if it maintains its identity, however we define it, either by it continuing to photosynthesize, by providing habitat for species, etc. We can get a little philosophical here. Now, resilience is often used in the context of or confused with other bodies of research like vulnerability, sustainability, and risk. It's important to clarify that this definition of resilience is all about coping. It doesn't delve in the root causes, what made this tree fall down, what are the conditions that enabled it, or the susceptibility of the system. What was the situation in the system to be affected by it? And it also isn't intrinsically good or bad, right? So while resilience is often perceived as a positive attribute, there are many destructive phenomena and bad habits that are very resilient. We can think of addiction or global warming, right? All these require extreme set of conditions to fundamentally change. So with that, we acknowledge that much of resilience research, like ours, has this fundamental motivation behind it, which is to sustain desirable system functions, which is usually associated with human well-being. So that's kind of the foundation for our work. Now, resilience has long been studied regarding a specific part of the system, specific disturbance, usually in a defined period. This is called specified resilience. We ask resilience of something to something, of what to what. But since the early 2000s or so, there's a growing body of research that aims to generalize things and our understanding of resilience. So there's an approach looking at the type of disturbance or the type of affected systems rather than the particular event. You can see here like rice fields in general or coastline communities in general. And even more broadly, general resilience, which is the focus of our work, emerged to relate to the system as a whole, to any part of it, and to any kind of disturbance. So this can include unknown, unforeseen, new challenges. And this is really the key issue here. So this builds on many specified case studies to identify sets of qualities or attributes or characteristics or principles. We're going to call them attributes from here on for the rest of this presentation that are associated with greater systemic resilience, right? So this is what you want to take away from our introduction. General resilience is the focus of our work. We address two main gaps regarding these general principles or attributes of resilience. So first, that there's been a challenge in testing and validating them. Here, we identified COVID-19 as an opportunity, an unprecedented opportunity of our lifetime to observe and compare how different social ecological systems that vary in their structures and mechanisms and external conditions all cope with the same shock simultaneously. Secondly, traditionally, social ecological resilience research has been focused very much on the ecological part of the system. So how we preserve the biophysical system, like a lake here, for the benefits of humans and despite human activities around them. But this gap has been identified in the literature, and our research aims to address it by truly encapsulating human society as a component within the single holistic system, right? So therefore, we set out to examine resilience theory, general resilience, like I mentioned, through the global disruption of COVID-19, looking at how the way that we use and organize within our environment affects societal resilience. Our main question is, what attributes can strengthen or weaken a society's resilience in the face of a major unknown and unpredictable crisis? To answer this, we figured we would first, on the left, assess the level of resilience during the time the pandemic broke, and then assess how we coped with it. And then by figuring out the links between them, we can identify the general resilience attributes we know from the literature and whether or not they manifest. But how do we address this? A little comic interlude there. What are the attributes associated with general resilience to any and all disturbance to a system? We need to figure this out. Okay. And how do we assess the extent of COVID impacts? What variables should we look at? Okay, we need to figure that out too. And then what attributes played a role in this coping situation? If we identify those repetitively across systems, that's something. Okay, so this is the structure of what I'm going to present to you today. Let's dive into the first part of the research. Here, like in each of the following parts, I'll present the gaps, the goals, the methods, the results, and the conclusions. Here again, you can follow the sidebar to get oriented where we are in the talk. So as mentioned in the intro, the general resilience body of research portrays a set of attributes which are associated with greater resilience. However, so these were therefore widely used as a proxy for assessing and measuring them. However, the theory of general resilience is not well developed yet. Studies identified these attributes in varying degrees of overlap. They're lacking terminological consistency. So our goals here were first and foremost, oops, my internet connection is unstable. First and foremost, to identify, whoops, sorry guys, to identify what attributes, this is difficult because I have something on my, okay. Our objectives were first and foremost to identify what attributes have been most recognized as being associated, conferring general socio-ecological resilience. And to achieve this, we needed to identify the key publications, these meta-analyses, to untangle the differences and overlap between them. And as we did so, we realized that we need to understand the relationships between these attributes and to take into account how they evolved over time, because newly introduced attributes would obviously be less established in the literature. So we conducted a literature review and synthesis incorporating these bodies of research. We started with a scoping review, followed the field of environmental education. This means an overview of the literature, identifying knowledge gaps and emerging topics, while not being limited to peer-reviewed academic literature. We used academic databases as well as Google search engine to locate reports by major research institutions and international NGOs. The ones that included a set of attributes associated with the systemic resilience entered our review, and the ones that didn't, we snowballed, meaning that we followed their leads to other sources, the ones that cited them, the ones that they cited, and then we repeated this until it was all saturated, and that's how we came about with 12 key resources, which we analyzed, we reviewed, we summarized them, what attributes they propose, their examples that they give, the approaches and methodologies, and how they reference each other and build on each other. And lastly, most importantly, synthesizing, where we reorganize the information to explore it more deeply, to gain insight about the body of research as a whole. This is where we observed the trends, how they developed, the gaps, the discrepancies, if there were any, and finally built a model to reflect the key processes and the dynamics among these attributes. Here we can see how we organize these attributes and the level of support we found in the literature for each of them. Highlighted are the ones that are most supported. You can see These are attributes that relate to the structure of the system, either its components or the links between them. And you can see broad consensus around diversity and modularity, as well as strong support for redundancy. Now, what do these actually mean? So diversity and redundancy can be to all forms. Diverse species, diverse landscapes, diverse cultures, stakeholders, things related to the population, interests, and perspectives, okay? Modularity is less intuitive, and I'll do my best here to convey it. It's a state where components, like in this little diagram here, are closely connected to each other. Are closely linked internally, but loosely connected to each other. So in this drawing, it means that when a disturbance happens in one part of the system, it doesn't immediately spread all over, right? So it can be contained to one part of the system. Now, so this can also refer to physical things like pathogens or invasive species. It could also relate to non-physical things like ideas. Think for a moment about the situation during COVID, where we had news quickly spreading through various channels of media. 200 years ago, some of the fake news that we saw during COVID may have had a more difficult time to spread as far and wide as we saw during the global pandemic. So this is the idea of connectivity. Another is an example of prescribed fire breaks. Those of you who are into forestry, if this speaks to you, great. Now let's just move on so I don't take too much time on that. These are attributes that we categorize as related to competency and action. They show broad consensus regarding learning and innovation, as well as strong support to managing feedbacks. Again, what does this mean? Interestingly, learning and innovation include various things, right? So it's experimentation and learning, gaining knowledge and skill building and innovation. This attribute is also strongly linked to other attributes like embracing change and monitoring, of course. Managing feedbacks mean that when a change happens in one part of the system, we quickly notice it and we quickly respond. So in Taiwan, for example, they had monitoring systems in place, another connection, and they identified that the pandemic broke out and they immediately closed the borders. That's a tight feedback loop. Keeping this feedback tight prevents things going unnoticed and escalating. The third and last category we identified is that of stores and assets, things that the system has or doesn't have. This isn't Jesus, this is Moses, but I mean, you see what you see. Here we see strong support for leadership. Again, here we see that leadership is acknowledged because it contributes to trust, to social networks, to forging common visions and goals. So you already get a sense of the complexity of this comparison and how things are far from being clear-cut and very much connected. So zooming out, we note that comparing these attributes across sources proved more challenging than we expected, and the way that each source chooses to frame an attribute emphasizes different parts of this picture. And I mentioned a couple of examples with learning and leadership, but we can also look at reserves, for example. Having reserved something, physical or non-physical, is also a form of redundancy, right? Having extra of something. Acknowledging this complexity made us look at the essence rather than the titles and shifted our focus from observing the number of resources that support each of them to how they come together, to the relationships between them. And all sources agree that there are strong connections between many of these attributes. We found that combined, these suggest a nested structure. So we developed this example of the attribute learning to portray how the literature sees the elements that compose it and how they interact with one another. So from the bottom, you see experimentation and monitoring, and moving up to skill and knowledge and innovation. All of them are fully connected to other elements. I just simplified this model. So we see that there's a process going from bottom to top that, although iterative, has clear directionality, a tiered structure leading from experimentation to innovation in order to ultimately improve our awareness of the crisis and our response to it. Additionally, from our synthesis, we can logically infer a tiered structure. This is a model of the categories of attributes that we identified. At the top, self-organizing is closest to enabling higher level of resilience, which is directly enabled by our flexibility. What is flexibility? It's a combination of having alternatives and the capacity and willingness to engage them. And this is achieved by three. At the bottom here, we have these three kinds of ways to achieve this flexibility, either by maintaining certain systemic structures, that's in blue, in the middle, by exercising certain management practices, or in green, by cultivating certain kinds of assets. This is an overarching, simplified model, and each of these category boxes has its own web of relationships within and across other categories. With much of the social ecological systems research emerging from the study of ecological systems and applied to human society, we also found a trend of this conceptual development in which, with time, publications transitioned from this focus on ecological systems to include more attributes concerning social elements of the system. So you can look here on the list of resources from left to right. On the bottom right, we see the recent acknowledgement of elements related to human psyche and behavior. So the yellow boxes, I failed to mention, the yellow boxes show us where one of the attributes was initially introduced. Okay, so we see agency and inclusivity, equity, power, and a sense of community in place relatively recently introduced to this literature, moving from more ecological emphasis to the more social emphasis. So in conclusion of this chapter, we see a broad consensus regarding the importance of components being diverse, for connections between them to be modular, right? To be connected, but not too connected, and for learning and innovation. We also see a strong support for redundancy, for managing a system's feedbacks, and for leadership. All this while recognizing that the numbers of titles here don't tell us the whole story. So overall, and this is the second point, we find that while titles and structure may differ, most reviewed sources that we examined showed much overlap in the attributes building blocks, really in the essence of the ideas that comprise them. So they're not that different from one another. And these insights regarding this interconnectedness, this tiered relationship among attributes, while it's preliminary and far from exhaustive, it suggests a need for comprehensive network analysis of these attributes. And all this while, of course, taking into account the human components, which is underdeveloped in the literature. All right. Here we conclude part one, and moving on, the second leg of our study explores the major impacts of COVID-19, which, despite widespread administration of vaccines, surpassed 7 million deaths as of October of 2024. So, and far beyond the health impacts, COVID-19 also triggered various other social, economic, humanitarian, and even security-related hardship. So at the time of the study that we started, like Daniel mentioned, at the early stages of the pandemic, peer-reviewed assessments were preliminary. They were scarce, and they were characterized by very narrow foci on specific types of impacts or specific populations or specific locations. Additionally, it paid very little attention to how they choose to measure what they measure, how these variables and indicators are determined. We also noticed that they strongly focused on the health impacts, on pandemic control measures, and on economic impacts. So we needed to get a deeper understanding of the story. So we set out to produce a grounded, more comprehensive, and empirically based description of these impacts, how societies endured during the pandemic, and to assess the extent to which each of these impacts was discussed in publications by various sources, and we used Israel here as a case study. What we did is conducted an applied thematic analysis and content analysis of gray literature in order to see how COVID-19 impacts were represented in the Israeli agenda. So we queried COVID-related texts published by three types of sources: news media, news media, government agencies, and civil society NGOs. Since the onset of the pandemic to when we completed the review in March of 2021. Overall, we collected 908 publications by 23 diverse sources. Our analysis included both a qualitative aspect where we reviewed all the publications, inductively coded what impacts they discussed, and categorized them. And then also a quantitative aspect in which we aggregated and compare the number of publications that refer to each of them by topic and by impact. Finally, we applied a systems thinking approach. You can see that I like systems thinking, right? Yay! To develop a preliminary model of relationships among the different impacts and the themes that we've identified in order to form a broader theoretical assumption. We developed the model manually, building on the knowledge that we acquired through both the literature review and our analysis of the great publications. We kept it very simple. Links were kept neutral, uniform in strength, and based on really the literal meaning of the text. And we used Atlas TI software to organize the model. So the publications point to these four main aspects: economic impact, social, health-related, and impacts related to governance, with a strong emphasis on economic and social aspects of COVID-19 impacts. Percentage here is total more than 100% because publications sometimes refer to multiple impacts or multiple topics, and this is going to be the same for the following figures as well. So what do these topics actually include? So they're listed here in this figure, color-coded in a similar way by topic. We see that the number and percentage of publications that referenced each of these impacts, results indicate that only a few of the impacts were direct result of the disease. So infection, morbidity, mortality, notably, are only 10% of the publications related to them. And that the majority of adverse effects here represented were indirect. They stemmed from the response to the disease and the direct impacts. Specifically, we can see here at the top, most referenced were economic impacts to business, to unemployment, and to the financial market, and fourth here to the healthcare system. This is what came out of our review.
Okay.
In addition to the actual impacts, we also identified additional repeating themes. They're not impacts per se, but they shed additional light on the nature of the discussion regarding the impacts. Again, this is all inductive, so no predetermined, but more emerging from the text kind of themes. We see strong emphasis on public policy discussions regarding the management of the crisis and social distancing policies, as well as criticizing public agencies for how they manage the crisis. So our results also suggest a tiered nested structure of relationships among these different impacts and the themes that we've identified. Many indirect impacts appear to be underlying drivers of others. Visually organizing them in a model allowed us to further analyze and discuss them more deeply. Here is an example excerpt from our full model, focusing on the economic impacts. So impacts are in rectangle, color-coded by the topics, as you can see here. Additional themes are in oval-shaped, and the lines indicate the relationship. Arrowheads indicating the directionality as well. The lines are colored by their source. So from the top here, if we're looking at the infection spreading, intensifying social distancing, causing business closures, unemployment, and this affects both banking, the market, foreign trade, and they also feed back negatively to their causes, right? Worsening the situation. So you can see from market disruptions that further increase unemployment and hardship to businesses all the way back up. This is how the full model looks like. Again, although preliminary, it reveals systemic interconnectedness, this cascade of causal links and feedback loops. It also suggests that there's a cumulative magnitude to these indirect impacts. For example, if you see the convergence of various extreme conditions into mental and emotional distress here. So economic hardship, uncertainty, fear of infection, mobility limitations, and social distancing all contribute and cascade down to mental and emotional distress. Most importantly, this model emphasizes the central role of crisis response mechanisms. So our main takeaways from this chapter of the study is that while we can identify the major impacts of COVID, our main conclusion here emerged from, the synthesis of, our main conclusion here emerged from the synthesis of relationships among them, highlighting this cascading cumulative dynamics. So the understanding that most indirect impacts stemmed from responses to the disease and its indirect impacts, either through spontaneous responses, like individual behavior or social reactions, or by policy, border closure, mask mandate, lockdowns, etc. So this emphasized just how significant indirect impacts can be and just how much policy response does matter. Models suggest that policies can have far-reaching and enduring societal consequences, potentially no less than the actual health impacts. Most importantly, it points to the need for a holistic systems approach where we recognize this complexity and address it. This brings us to the third and final chapter of the study, where we draw on insights from the previous two chapters. So here's a little reminder. We started out this journey by asking what social ecological attributes can strengthen or weaken a society's resilience in the face of a major unknown and unpredictable crisis. And if you thought that the answer is going to be clear-cut, well, shocking. So combining insights, what attributes really did play a role in societal coping with COVID-19? Let's see how we answer that. So we decided to validate these attributes through a qualitative case study where we explore how resilience attributes existing during the time that the pandemic hit help mitigate the effects of the pandemic so that the impacts that were experienced on the ground affecting how the impacts were experienced on the ground. So the role that they played and how they translate to actual impacts. That makes sense. Our case study takes place in Taiwan in collaboration with a local group of dedicated researchers. And this defined region, Changhua, is a long-term social ecological research platform, which is a part of the ILTER network, or the International Long-Term Ecological Research Network. We started with interviewing a diverse group of stakeholders to produce causal loop diagrams, essentially mental maps we drew with each of them to identify how they experienced COVID. What were the impacts, drivers, mitigating factors, how they may be connected. We then aggregated these results to create a fuzzy cognitive map. It's like causal loop diagrams, but we have weights on the different parts of the map. And these convey the level of agreement by participants to form a core of high consensus all the way to the fringe issues that were raised by a mere few. Then we conducted a network analysis to identify key elements in this map. And third, we collected background data regarding both the impacts of COVID, direct and indirect, like mortality and unemployment, and then also characteristics of the place regarding demographics, the different sectors, the population density. And then in a group setting, we circled back to the same stakeholders we interviewed initially to reflect on both our analysis of their experience of COVID, this fuzzy map, and some of the official numbers that we found. And through this interaction of engaged stakeholders, we deepened our understanding of the central narratives. We analyzed the transcript afterwards, updating the map, the fuzzy map, and identifying themes and narratives that relate to resilience attributes. Finally, we looked at all of it, synthesized it, and to ask ourselves how and if the attributes really emerge from all these collected narratives. This is what the fuzzy map looked like when we introduced it to the participants. You can see the level of agreement represented by the color of the nodes. The color of the links simply indicates if it's a positive or a negative connection, but there is data behind it. It's just you can't see it in this image. And we excluded the lowest level of agreement just to keep things manageable when we interact with the stakeholders. This is what it looked like when we actually present it. This interaction with and among the stakeholders was just as important to me as the information that they provided. It meant walking the talk of transformative socio-ecological research, designing a study that is not just extracting information, but is mutually beneficial. So we shared data back, we built capacity to think in systems, and enabled relationship building. The local experience during COVID was characterized by key narratives that reflect many of the resilience attributes that we explored before. So here are some examples. I can't present all of them. So the two main impacts identified by participants were fear and the decline of tourism. The central role of fear really highlights the strong role of subjective perception. Like if you remember, we saw this in the resilience attributes, the subjective perception in understanding the overall resilience of society. And then the strong impact on tourism, which is a fundamental pillar of the local community, really exemplifies how important it is to diversify our economy. Now, oh, and it's not listed here, but some people also adjusted their business model to fit the new reality, which also shows us learning and innovation capabilities. Finding that optimal level of connectivity where pieces of the systems are connected but not too much is reflected in characteristics of the population, like low density of the population on the one hand. So the pandemic cannot spread as easily. And also the very close social ties. On the other hand, people felt close to one another. It also surfaced from the driving role of the media as a connector among people at a time where we weren't able to meet in person, but also, on the other hand, spreading information and ideas far and wide. And this emphasis on close community as a supporting mechanism also indicates the principle of social capital. This against the aggravating factor of minimizing contact, which adversely affect the level of trust among people, also help to control the spread of the virus. I realize this is a little tangled. Where are we? Right. So just like fear, mental and emotional health in general also came up very strongly at the tail end of all of this, really solidifying the emergent recognition that we saw before of how important it is to look at the subjective experience. Lastly, these couple of additional narratives highlight how these attributes are connected. So the population in the area is aging, and this shows us that the lack of diversity during the time of COVID really impacted the local population because they needed a lot of support, but this was also compensated by close community ties and by engaged leadership. A strong thing that came up also was regarding data and monitoring. So very little official data was available, and whatever was available was sorely inaccurate. And this in turn affects local trust in government, right? And provision of adequate support during the crisis. So again, here is where we saw engagement of local leadership and close community ties really play a significant role. All right. So this study was the first step to answer this question, right? And we answered this for Taiwan, which affirmed much of what we learned from the previous two chapters, identifying how these attributes manifested, and that there's definitely a need to further explore attributes related to human society. And if we follow with additional similar case studies for diverse socio-ecological systems, we could accumulate evidence to make sure that it's not just context specific, right? However, perhaps the most important thing we learned through this work is that just as much as attributes matter, so must we pay close attention to the connections between them. In developing the theory, right? So if we understand these relationships better, maybe we can identify key attributes, like we know key species, right? Ones that have greater overall effect on the entire system. And therefore, managing them is more important. And in practice, when we assess resilience based on these principles, or when we initiate action to strengthen them, we need to understand these relationships and how, and this will inform a more nuanced resilience building efforts. Oops, sorry. Now, the broader challenge now would be to complete this in multiple contexts for a comparative study, to accumulate evidence really regarding these attributes and how they manifested in different social ecological systems, happening for this same disturbance at the same time. So our work was really the first step, setting this foundation that hopefully I would be able to replicate in additional locations. We've already started work in France, and Mihai, you're on this call, so you're it. So really what we learn from these attributes, and this is the magic really in my mind, what we learn from these attributes could really inform protocols for long-term social ecological research, right? Standard observations are now being formulated in these different networks for long-term social ecological research. And what we learn about these attributes, I feel, could really support these efforts. Coming to a close, I can't believe it. Like to express my deepest gratitude for too many people, and I probably left some people out, so apologies in advance to my amazing advisor, Daniel, to contributors of this work, my mentors at YASA, Brian and Elena, and contributors in Taiwan and in France. Thank you, Lin, Yulin Song, and Ting Tian Chen, and the team, and Sabrina Gaba and Chloe Lefebvre. I hope I said that correctly. Of course, to those supporting and funding this research, the Horizon 2020 project, Alter Plus, and the ILTR Research Initiative Seed Grant. I'd also like to thank my lab, the professors who gave me a chair and a desk and an ear and advice, my lab partners for their insightful comments throughout this very long process, and especially our lab manager and extraordinaire Neat. The university for giving me this awesome gig, the administrative staff that supported my international frolicking, etc. And most importantly, my family and friends galore, but most importantly, my mom, who encouraged me to always learn, my dad, my grandma, my brother for their continuous support and encouragement, my friends who picked me up in times of struggles, especially Sarah Goldberg sitting right here, was kind of responsible for me being here to begin with, because she made the connection with Daniel, to Adi. And thank you all for your super kind attention. And I welcome your comments and questions to this talk during the session and afterwards, of course. Cool. I did it! I did it!
Phenomenally, on the
Phenomenally. And on the first try.
That wasn't the first try.
It was on the first try. All right, let me stop sharing my screen. Oh, geez. Wow, that was a lot of talking. Okay. Hi, everybody. Who survived? Let's look at the survivors. Mihai, did you like the picture in there? I didn't have to update the slide.
Very nice picture, yes.
Okay, we have time for questions.
We do have time for questions. I think I'm going to regret it, but yeah, great. Let's see. Whoops. I'll take this one.
So now we have time to turn to you on Zoom, of course, or in the room to take questions, clarifications, further inquiries.
I realized that was a lot.
Can we go back to the slide?
Mhm.
Can we
Which
go back
one?
to the slide and the methods where you did the mental maps and then the aggregate mental maps?
Yeah. Let me find
Oh,
it and then.
Janet's here too.
Hmm?
Look at Janet's here.
Hi, Jen and Liat. The mental maps
And Ron. Wow.
and the aggregate
What an
of the people in
audience.
Taiwan, correct?
Yeah, no,
Yeah.
the one in the methods. Yeah,
This one. You mean
before. Yeah,
this one?
Yeah.
Okay, hold on. Let me share my screen. Oopsies. I hope y'all can see that.
There we go.
Give me a holler if you can't. This one, Sarah? Yeah.
It's a question.
Oh, it's a methods question.
no.
I'm looking
Wait, no, I
for.
want to see it. I'm really curious. Do you think you were asking, there were expert interviews, right? Mostly, like stakeholders were experts?
No, stakeholders were diverse. There were a couple that were like municipal heads or people who are more prominent in the community. But many it could just be someone who has a business and just someone who's a farmer, just to keep it as diverse as possible. People that represent the different sectors of the area.
So do you think that if you did this research all over the world and you were able to compare between different types of stakeholders, like between public health professionals and municipal professionals and labelers, that there would be more similarities across types, or that the different cases would be more different? Do you think that people's perspective like influenced a lot what they saw as the relevant attributes, or do you really think the local differences are going to be overwhelming? And you haven't done this research, so I don't expect you to have a clear answer, but I imagine that you started to see patterns already in the data that you did collect of differences.
I'm not sure I'm going to be answering it very, very accurately to your question, but you're making me think of what that would look like, and I get really excited because of the role that we saw on how culture and the local subjective perception and local beliefs and even social systems play a role. I think it would be really interesting to do this type of process with people that have the same role in different places. I don't think that they would be the same.
No.
I think it would, but I think it would very much highlight what
So cool.
what
Like your
made a
methods are very
difference.
cool.
What made a difference. So you're making me think that, in replicating this, I need to follow. Well, it's a give and take because you want the people that you choose to represent the place. So if the place is more rural, like you can't compare this place with New York City, right? It just wouldn't have the same representation.
Right.
But if you have a large enough sample, if you do this across 20 sites, then you can take, okay, let's take the 7 that are urban, let's take the 7 that are rural or that are more similar, and then compare those. But that's a lot of work. Let me see if I can can't see people on Zoom. I'll stop sharing again.
Unless there's a question on Zoom, I have a question.
All right, is there a question on Zoom?
Yes,
Daniel.
Merav.
Oh, Taha.
Hi.
Hi, Taha. Oh, you're in the dark. There we go.
No, it's good. Nice to see you. Thank you for the presentation. I have a question about perceptions of resilience. So, what did you feel working with these different stakeholders? Did they perceive resilience similarly, or did they have a different perception of resilience? Because at least I feel that within the different disciplines, there are different perceptions of what resilience means. So how did you work with this with the stakeholders? Or do you have an impression of it?
So the simple answer is I didn't. The reason so in your question, you make me think deeply about the limitations of my study. But we wanted it to be a clean slate. We didn't want to confuse people that are not academics, right? So we didn't want to confuse them with too much jargon and theory. So we just had a conversation about COVID. We just had a conversation about the impacts, how they experienced it, what were the reasons it was experienced more or less severely. And then from these, we extracted the narratives that we find correlate with the attributes of resilience as it was identified by the literature. But I totally hear what you're saying. It's us, the researchers, interpreting their experience into these resilience attributes from the literature. So that's a key limitation of the study. Does that make sense? Was that clear?
Yeah. It was clear. And it's not something that you're dealing with alone. I'm also dealing with this. But then my question would be to yourself. How do you perceive resilience, and is it necessarily good or bad, or how would you say? Do we need resilience somewhere and somewhere else not, maybe? Actually, I don't know. How do you feel
No,
about it?
so let me, in the beginning, when I gave kind of the introduction to what resilience is in social ecological systems research, we touched upon these underlying assumptions because we had to be clear on those to move forward. You're 100% right. Why is it taking so long to move back? So I'll just do a refresher here about how we perceive resilience. Or this is our working definition of resilience, okay? And we're very clear about that in the study. It is coming from social ecological systems research. It's very clearly defined what it is and what it isn't, and that it's not intrinsically good or bad, but it is guiding our research as, you know, the desire to maintain desirable system state, if you will. Okay.
Great, thanks. Sorry, I missed the first part of your presentation.
Okay, no worries. It's recorded. I'm happy to share it.
Yes, please.
All right. Any other questions from the audience?
I'll ask a hard question if there's time.
Ooh. Oh, I should look at the chat. I think it's mostly. One second. Let me just look at the chat. All right. Okay. Good luck. Congratulations. Great. Okay. Any questions? Awesome. Cool.
To Jen.
Hi, Jen.
Hello.
Please.
This is fantastic. You did a lot of work, which I already knew. And I'm wondering, like, before you do a comparative study and get like lots and lots of case studies, and I'm kind of asking this for my research because I'm studying something else. And I also say at the end, like, oh, but I have to study many case studies and then find the patterns, and then I can say something. So I wanted to just put you on the spot and say, like, if you had to develop recommendations or advice for policymakers who are like, oh, what should we have done better? Or what could we do better for the next pandemic? Like, what, you know, on the off the cuff, what would you say? Because I'm wondering, like, are you going to say we have to really have diverse, redundant, modular systems, and that's like a huge amount of work? Or are there, I don't know, more actionable things that policymakers and people like that could do?
I think well, you're asking for tangible, but also have to be broad enough to fit for everybody, right? So I would say that the main takeaway that I have from the study is that sometimes we get too bogged down to the components, and then we lose sight of how they're connected and how they influence each other and how they ripple. So especially in modern day bureaucracy, like you see so much siloed operation where you don't consider the impacts of everything that you're doing And you also, and if you do, then you don't think it's significant. You're like, well, whatever. But when you look at the accumulation of it and how mental health, for example, is such a huge, has such a huge cumulative impact from all of it, then it doesn't matter that this is the situation here in Taiwan or elsewhere, or it doesn't matter. You have an idea that that what you're doing may have an accumulative major effect. So I think the bottom line is breaking these silos and start thinking and designing in systems, both for monitoring, right, and for initial design. And I think that would prevent a lot of this cascading impacts that we see during crisis. And this is on kind of Regnachat, you know. I have to
That's a
think
great
about
answer. Yeah. Thank you.
Taha is departing.
All right. Bye, Taha. I'll take any other questions unless if you don't. Wow.
And I will save mine for a cup of coffee.
Awesome.
So
We're at time.
I would like to thank Merav. And really thank all of you as well. Obviously, Merav, if you were here or not here, she would have had to have given her seminar talk, and she would have given it to me. But it really, really helps that such a wonderful group of people with such relevant questions also joined us today. So thank you very much for all of you who joined us on Zoom. Thank you all of you who are sitting in the room. Bravo.
Thank you. Thank you all. Thank you so much.